A national scandal at VA hospitals has put all of them, including ours here in Asheville, under the microscope.
The Charles George V.A. Medical Center was part of a federal audit into patient scheduling. And tonight's reality check, News 13's Frank Faboni joins us with more on what the audit found.
Frank, how did the local VA hospital here do?
Well, a team of inspectors made an unannounced visit in May. The audit results were released yesterday, and the Asheville VA got a healthy grade. But that doesn't mean they don't get complaints. Kalina Weathersby believes her husband, a retired veteran, is an example of what's wrong at VA hospitals.
I was shocked to see it come out.
She says she tried to convince the Asheville VA her husband needed to see a local specialist for colon cancer, but was instead sent to the VA in Durham.
I begged them to fee-base him to Mission Hospital. It doesn't make sense to send somebody 200 and some miles away and then he got to come home in pain.
He got his surgery after a 2-month delay, but the cancer had spread.
And so now he's in an advanced stage of cancer.
Asheville VA Chief of Staff Dr. Carl Bazemore by law can't talk about her specific case, but says fee-based local care is allowed in certain cases.
We're very responsive to any of our patients' needs, concerns, questions, or complaints. And I think we all take their care very personally here.
And we just had excellent results.
The hospital's medical director says the federal scheduling audit shows the Asheville VA had some of the shortest wait times in the country while experiencing the fastest patient growth.
The team and their exes said we were a benchmark for the way that we handled our scheduling processes, and we received very high ranking.
But the national audit did find problems system-wide, including 13% of scheduling staff interviewed said they were instructed to enter a date different than what the veteran had requested. 8% used something other than the official electronic wait list, and in some cases were pressured into using unofficial lists or engage in inappropriate practices. And a 14-day wait time performance target, an incentive for leadership that was not attainable.
Even our community partners would share with you that it's very difficult to get all patients scheduled within that timeline.
The acting Secretary of Veteran Affairs ordered that target removed immediately from all performance contracts to eliminate any wrongful misconduct. But none of the findings will change what Kalina believes happened to her husband.
Everybody can sugarcoat something.
The Secretary of Veterans Affairs has ordered a series of actions, including a hiring freeze, new patient satisfaction measurements, and an independent external audit of scheduling. The director of the local Asheville VA believes that will have a positive effect, resulting in more staff and better systems to care for the growing number of veterans.